Hello and welcome to Traveling Light. My name is Lisa, and today I want to talk to you a little bit about working with pain. Now, a lot of people think, and it's true, that Qigong is a gentle energy technique. It's not, I like to tell people, it's not slow, boring exercise. Qi is energy, Gong is work or skill. It's energy work, working with the energy in and around your body. So, one thing I like to remind people when we are talking about working with pain is that sometimes it doesn't seem logical, but Qigong can be too vigorous for certain bodies at certain points in time. So, I want you to become very aware of your practice. If you're having back pain or neck pain, if you have some acute pain that's been diagnosed and you have instructions from your doctor or physical therapist, of course you must follow that. If you have undiagnosed pain, especially any pain that comes on very suddenly and doesn't go away, you need to go to your doctor. We're talking more about pain that hurts, but you know is not an acute situation or something that could be harmful if you don't get medical care. Sometimes chronic pain, the kind of pain that we're talking about, it can be quite painful and it's easy to be afraid. Oh my gosh, what's wrong? Something's wrong with me. So I want to suggest that an important benefit to Qigong is learning to sort of walk that line between being afraid of what's going on in your body because you're not quite sure, and also working with it skillfully, learning to understand what is your body's baseline. What happens when you do a certain movement too quickly or too much? And then what can you do to modify that or to back off it? And a lot of times when we have this degree of chronic pain and we've come to something like Qigong, you'll be surprised how much more slowly, more mindfully, more skillfully you can interact with your own body, maybe more than you thought you could, more than you have before. So if you say you're a runner and your knee has been acting up, and so you know, okay, if I run 5 miles, it's too much. If I run 3 miles, that's okay. If I wear these shoes, it's going to hurt the next day. I need to wear these shoes. So you start to know and work with your body. Now, with energy work, we're bringing that down even to a more minute level. So I'm going to show you what I mean. For example, my arm, I think my shoulder has been impinged. It doesn't like it hurts when it gets up above my head. So I just want to show you what I mean. I can move this arm all the way up easily, no pain, no problem. This one, when I get to here, I start to feel that little impingement, that twinge of discomfort, and I can get my arm to go all the way up where the other arm is. The thing is, I'm already, it looks like a gentle movement. I'm already forcing my arm. I know that because I feel it pulling in the back here. I feel my back, my lats are already starting to clench up like, oh, that's too much. And so does that mean that I should keep doing that, right? When we're injured, especially if we haven't been moving a lot, if we have chronic pain, it's a good idea, right? To keep it moving. You don't want it to learn and have the connective tissue or internal scar tissue all kind of crunched down so that after a while, like, oh no, I can't move at all. So yes, we want to keep it moving. I think that sometimes people take the keeping it moving even to too much of a degree. Like if, for example, with the running, they're going to keep running those 5 miles because they're going to push through it. They think their body's going to get used to it. I'm sure you've had some situations where that was the case when when you're strong, when you're training, when maybe you have like a little pain, but it goes away right away and it keeps improving. If it doesn't keep improving, it's time to start working on a deeper level to work with your energy. So what that looks like is if I'm moving my arms overhead like this can keep going up. When I come to right here, it's already uncomfortable. It's not hurting. It's not a stabbing pain. And so because I want to get that arm up there, I might keep pushing it up. If I do that a couple times, and I have, and I wake up tomorrow and I'm like, oh, my back even hurts, my neck hurts, everything hurts because this whole situation here did not want to move all the way up yet. So you can either just move it as far as it wants to go, and you're going to have to slow down. If you're going quickly through your practice, if we're doing, say, pulling down heavens, and you're moving through quickly, like, oh, it actually starts to feel a little better. And that's okay if it feels better and then tomorrow it doesn't hurt, you have no negative effect, great, keep doing that. It wants to have that increased movement. I've learned now that that is just a little too much if I keep doing it. So I might sort of mirror with my arm that isn't having that comfortable range of motion. And I'm mirroring it not even to its logical extreme, because in my mind, I am imagining that it's going up all the way. That's one way to work with energy, is to imagine that that arm is working within its healthy arc. Now, this might not make sense at first, but as you start to work with energy more and more, you'll see what I mean. The other thing I could do is do them one at a time so that I can get very, very aware of this arm. And so that might look like, okay, it's okay up to here, super slow. And now I'm going to breathe into it. I'm going to feel very specifically, sense physically into this area. All right, what's the minor, like little teeny tiny adjustment that I have to make for this arm to feel better? And breathing. The breath softens it. If you don't know how to work with and soften your breath, you can look at some of the other videos that I've made. You might have to try this to see what I'm talking about. So up to here, it's fine. Imagining that arc, feeling the energy soften, soften, soften. Nope, up here is the right amount. So little by little, you can work with that slowly, skillfully, in touch with your breath and in touch with your energy. If you don't know what your energy feels like, that's what we're doing here. So you can keep working with that until you get to the point where you start to feel that little buzzing, that something that's like in and around the muscles that guides you. It feels like, you know how we do opening the flow sometimes, and you feel how your arms are being pushed up by a force that doesn't feel like you, right? And the same thing can start happening over here. Using my muscle? No, I'm using my energy, energy, energy. It's floating up right here. Not so much. So stay very aware. Know where you're at. Pay attention to your body. Know when you have to go even more slowly, even more mindfully, and then engaging your imagination, your very specific sensing, your awareness of energy to get that shoulder or whatever it is for you moving little by little by little into its more healthy, normal range of motion. And, you know, that might take some time. And I don't want you to be discouraged because you came to Qigong because like, oh, it's healing and it's you know, it's going to happen more quickly. You know, while you're strengthening and balancing the energy in the whole rest of your body, your part that's hurting is going to get on board little by little, and you need to be patient with it. You need to give it time. That's the difference between, quickly, and nothing against this, but sometimes it's the right time to go to the doctor, get an injection, make it feel better, and that's it. Maybe you've got those injections and it doesn't feel better anymore, or you got one and it didn't really work for you for whatever reason. Then that's the time when it's time to slow down. No, I'm going to work with my energy. I'm going to get my whole body more healthy, more flexible. And that might take a little bit of time. On the other hand, if you don't start doing it, if you keep trying to ignore it, to push through it, or to just let it hang like, oh, I can't use this arm, then it might take even longer. All right. So make sure that you're paying attention to the difference between fear of moving your body and um, and moving it too much, bringing it over its comfort zone, maybe not even over its comfort zone, but over its zone where it's going to be able to heal. So don't be afraid, but don't do too much. Go to your doctor if you have to, and keep practicing your energy work so that you get to feel on a like smaller and smaller and more specific basis the energy and what's going on in your body. Okay? Okay. Thank you for being here, and I will see you in the next video. Of course, if you have any questions, leave me a comment.